Good morning and welcome to The Big Show and TheBigShow.tv. We are live on TheBigShow.tv. That's our Facebook page. Our guest for this morning is Dr. Geraldine Tan from the Therapy Room. Good morning, Jerry.
Morning!
Good morning!
So bright and chirpy for the topic we're about to get started on.
Yeah, well, outside echoes the darkness of the topic we are talking about.
Oh.
Which is PTSD, Post-Traumatic Stress Disorder.
Yes, well done, Glenn.
Thank you.
What exactly is PTSD, Dr. Jerry?
PTSD, so it's post-trauma, right? So you have trauma. What is trauma? Trauma is when your world is rocked upside down. And the world that you know that is supposed to be safe is no longer safe. And not only no longer safe, it's kind of rocked you in a way that you don't know how to regain balance.
Okay.
And when you say trauma, it can also, it's not necessarily just physical trauma, right? It can also be emotional and mental trauma?
So all the different sort of traumas that can occur, physical, emotional, verbal. So all the different abuse can cause it also. Different situations can cause it. I just realized, am I having an echo there?
No, you're fine.
You're
Perfect.
fine.
You're absolutely
You're
fine.
perfect. You're perfect.
You know, Jerry, for someone who is suffering from PTSD, do people who suffer from PTSD get hit by panic attacks as well?
Yes. So all the different comorbids, which later on we can go into. But I guess PTSD first came out with the post-war, where the soldiers came back and everybody expected them to be like as per normal, like fall back into life and everything.
Yep.
Yeah.
That's where the word shell shocked come from, because they were going through so much and their world was not safe at all.
Oh, that's interesting. Shell shocked and PTSD are the same thing.
Yep.
Oh.
So initially when they coined it, they didn't know what to call it, right?
Oh.
So they call it a variety of things, including shell shock.
Yeah, I think that was the first time I heard of PTSD. It's from watching movies, war movies in particular.
Yeah.
And you can understand why, right? Because while they're there, they see loads of things.
And they have
made
to do things.
Yeah.
Made to do things, and at the same time, that visual stays in their minds. Their friends being blown up because they've stood on landmines.
Yeah.
The torture that some of their friends go through,
POWs and all that,
as POWs. And when they get back to civilian life, they can't help but have these visions of what they've been through. Is that the main reason for PTSD, Jerry?
So the world that they knew, looked very dark, looked very bleak, and looked very unsafe, dangerous, and they could not get out of it. So most of the time you feel like you cannot get out, and soldiers cannot get out of that, right? Because they have to be on the battlefield. Yeah. So that's when it first started. But now, thankfully, we don't have wars like that, or some countries are still warring, but we don't want to go down that path. But does PTSD still occur? Yes, it does. It still occurs.
And
Why does it affect some people and yet not all?
I knew FD was going to say that.
And how do you know it's really PTSD? Or it could be a short-term reaction based on an event that someone has gone through.
Yeah.
Okay, so I'm going to address FD first.
Can we address it live on Facebook?
Yeah.
Okay.
Let's do it.
All right, here's Depeche Mode, Strange Love on The Big Show.
All right. So, Jerry, my question to you is, why do some people get PTSD and yet others don't?
Yep. So I want to put it out there. A lot of people often say that, get over things. Why can't you get over things? PTSD does not mean that, you have a weak mind or a weak heart. Sometimes it's where your whole resilience is broken down. You got into a situation where you didn't expect to, or your brain just simply cannot manage at that point in time. For example, road traffic accidents, okay, and someone being caught in that whole car wreck. Okay, can suffer from PTSD. Why? Because it's not a common occurrence. You don't have car, accidents all the time, or road traffic accidents all the time. And you're stuck there. Your world is just turned upside down, and you start to worry, will it come back again? Why was I placed in that? So the whole system is short-circuited.
Okay.
So it's like being blindsided by a situation.
By the circumstances or situations, yes. Where it just takes you into a different dimension.
And it's not because you have a weaker character or a weaker personality. That's got nothing to do with it, because the strongest people can get affected, right?
And we all have, weak spots. All of us have
Trigger
weak spots.
points, right?
Trigger points, sore points, Achilles heel.
Yeah. So is it like a chemical imbalance in the body then?
Okay,
right?
so when your body is being thrown, so in any situation that you need to deal with, your body is thrown into a stress state. So your body goes through stress. So it produces a lot of adrenaline, a lot of cortisol, and then the body forgets to kind of calibrate it or reduce it after the whole situation.
Right, okay.
Okay.
It still continues.
Okay, so you're talking about the body going through stress. There are different levels of stress. So are there different levels of PTSD?
Yeah. How do you diagnose it, Jerry?
Okay, so when they come, most of the time they will have three, what I call the triangle. The triangle would be the first one, avoidance. Avoidance of a situation, avoidance of certain things. Okay, so perhaps a girl comes in and she doesn't want to be touched. She not only doesn't want to be touched, when you go near her, she pulls away.
Okay.
Okay, so avoidance. Okay, then you have the alertness. So the triangle has triple A. Alertness is the second one. It's a hyper vigilance. You're on a constant lookout for any sort of triggers, any sort of dangers that may be around.
Okay.
Okay.
And the last one is anxiety. You panic, you have your panic attacks, you're high tension, you're paranoid about everything, you cannot let go or let yourself go because there is danger all around.
Right.
So PTSD doesn't just stem from things like war or like an accident, like you say. It also comes from things like physical abuse by someone in a household, rape, sexual abuse, and all that. Which I mean, you sent us some pretty disturbing articles this morning. Some articles that were recently in the news.
Yep.
So we were speaking about triggers earlier, like for those that have gone through war, and I would imagine like loud sounds, sounds that emulate sort of gunshots and bombs and things like that. What about triggers for those that have gone through physical abuse?
It can
Touching?
range from touching. So one of them, this is a 50-year-old guy, and he comes here. One of my pro bono cases, actually, and his body, is so tense all the time, and you wonder why is it so tense. So he started telling his story. His father had been beating him since he was a little boy, and he's the youngest of so he's not the youngest. He's one of the children somewhere in the middle. Okay, he has older siblings and younger siblings, but he was the only one singled out by his father to be beaten up. Okay, and he was beaten up until he was quite old. Okay, but thereafter a strange thing happened. He would want to go to his father and tell the father, beat me up.
Right.
So this occurred until the father, until he came for therapy, and he managed to stop. As the father has passed away since then, that reduced the anxiety a whole lot. But whilst he was on therapy, you could see a lot of PTSD because he was looking around, hyper vigilant for any old man.
Oh,
and
wow.
any old man reminds him of his father, and his body would tense up. The feeling, he could feel the sensation of the beating.
Okay.
And then when he can't feel it, he would try to, that's why he would go to his father and get that beating.
Right.
Because his body literally
Was so used to it.
not only used to it, his body itch to feel that pain on his skin.
Do those that get abused often abuse?
Not all of them, but they are scared. They are very scared that they would emulate the same behavior to another person. So you are right. But it does not mean the cycle cannot be broken.
Okay.
Okay. We'll come back with. Well, you're gonna answer my question, right? Which was how do you diagnose PTSD?
How do you diagnose it?
Okay, coming up TV, we are with Dr. Geraldine Tan from the therapy room talking about post-traumatic stress disorder today. And my question for you earlier on, Jerry, was how do you diagnose someone with PTSD? Because, not everyone has PTSD. Some people have PTSD open and close inverted commas for a few days after maybe a traumatic experience or a bad event or something like that. Is PTSD something that is over a prolonged period of time?
Yes. So remember that any disorder, it needs to affect functioning. So you would see that they are, so the triangle, the avoidance, the alertness, and the anxiety. So you see a lot of emotional symptoms. You see the insomnia, they cannot sleep, there's sleeplessness, a lot of flashbacks, nightmares, because of the hyperarousal or hyper alertness, sometimes they cannot sleep. It affects their functioning at work. They cannot deal, or manage themselves at work. Affects social relationship. They don't know how to relate to another person properly. They don't know, how to engage with them or even, permit anyone close to them because it is just too scary. They sometimes cannot even look after themselves because they're so worried or scared, so hygiene goes down. The attention, so executive functioning, all the attention, memorizing, acquisition of all the different information just goes down the drain. They can't do it. Yeah. So those are a few things that we're looking out for. And of course, I think Glenn was saying something that is very true. It has to be for a prolonged period of time. So if you're observing it for a month, 2 months, and it's not abating, then you probably have PTSD and go for some consultation.
Do you get people who just basically say, "Oh no, I'm just stressed. I'm just stressed." They run away from it. They don't want to acknowledge it.
Yes. So for this 50-year-old guy I was talking about, for the longest time, his friends had been asking him to go somewhere. And it was his, sometimes we are so blessed with wonderful friends. His friends actually called for him, made the appointment for him, and ensured that he came for the session.
Wow.
Just very quickly for the benefit of people who are not watching us on thebigshow.tv and who are listening to us exclusively right now, this story of this 50-year-old guy you were telling us about, he was abused by his father father, and right now, I mean, he is still seeing you about this issue. Tell everyone about this guy, please.
So this 50-year-old guy, he was beaten since he was young, and he never really broke away from that, So instead of growing up and leaving the house, he actually went back and consistently asked for beatings, because his body was reacting to it. He was itching. He literally said that my body is itching, and I
Itching for more beating.
Yeah, I need to be beaten up, because that was his definition of attention. He doesn't know whether his father loves him, but that's the only attention that his father gave him was the beating.
Oh my gosh.
Right, but he's seeing you right now at the age of 50. At what age was he still going back to his father for, what?
At
At 50
50
still.
So his father just passed away, you were saying, right?
Oh,
So-
My goodness.
Yep. So now he's
Oh my
51.
goodness.
So so he came when he was 50, and so just when he came, so after he came to me, we managed to stop that behavior, but it did not mean that he did not go back to the father's house and stand there.
Right,
Oh my goodness.
Wow.
Yeah, but he managed to restrain himself.
right.
So, Dr. Jerry, you're saying that this father of your patient was beating his son up. How far back does it go? Like, how far back do you dig to find out why? Do you find out things like why the father would have done something like that? Does it go
How
that
would
far
we
back?
know?
You would, right, okay.
Yeah, the perpetrator is not there to verify anything at all, right?
Oh my
Yeah,
goodness.
so will we ever find out the actual reason? We might never find out the actual reason.
But I can't help but
know?
think right now that there was something wrong with the
The
father.
father, yeah, that's
Yeah.
why
Because
that's why I'm wondering, yeah.
I thought the beating stopped maybe in his early
20s
20s
or
or something
something.
like that. But for you to tell me that the father was actually
Appeasing him with
yeah,
that, yeah.
by beating him up to a year ago
No, but
before
I-
he passed away is mind blowing.
sick.
I can just see the problem, because if he was itching to get this
Attention.
beating, this attention, you as his psychologist would have had a whole different set of problems to deal with once the father passed away, because now he's got nowhere to go to get the beatings.
Oh, so thank goodness for that. He came before the father passed away. So we were able to prepare him because,
Okay.
father's not always going to be there.
Yeah,
right.
And he needs to learn self-love
Yeah.
and self-respect.
And how old was
build
his
that
father
up.
when his father passed?
80 plus, 80.
Oh.
Wow.
Yeah.
And how is he handling it now? Now that his father is gone, I'd be keen to find out more about
Okay,
this particular case.
we'll find out a little bit more on thebigshow.tv. Meantime, here's Pink with Most Girls on 1FM 91.3.
So his dad has passed, and he's here in inverted commas on his own. How is he dealing with it now?
He is doing much better, knowing that the father is not there. He don't need to look out for the father anymore. There's lesser hypervigilance there, which is wonderful. He's now able to open the windows. He was so afraid that he was going to jump from his floor
Wow.
that he actually boarded up everything.
Oh, wow.
Wow.
Yeah, to keep himself safe.
Does he
So
live
now-
with anyone? I know this is digging too deep, but is he on his own?
He has friends, but the problem with, PTSD is that they tend to recluse themselves because they're so scared and so paranoid, and the noise level in their head is just too much. Yeah. So they tend to try and withdraw sometimes.
Well, he was quite privileged because he's surrounded by a good support group of friends that actually made this appointment
Yep.
for him. But if someone is on their own and needs to seek help, when is a good time for them to seek help to realize that they are suffering from PTSD?
I mean, the second you start, feeling uncomfortable, you start feeling like, you can't sleep, you can't eat. So, signs and symptoms of all the depression, and then irritability, or you start having your nightmares. Just go to a doctor. Any doctor will do, and the doctors will be able to direct you to the right personnel anyways.
And who would this be? Would it normally be a psychiatrist or a psychologist?
So the therapy work usually is with the psychologist. So we process all the different parts of the memories and the trauma. The psychiatrist comes in where there's comorbidity of like major depressive disorder, anxiety disorders. So the different other comorbid clinical disorders where it requires medication.
Sorry, what's comorbidity?
Comorbidity.
Comorbidity.
It comes together with another disorder.
Right, okay.
Something plus something.
Okay.
Jerry, can medical conditions cause PTSD?
Yes, I think one of the articles
Yeah.
we saw, right?
Yeah.
Can definitely. So I've had a range of different people come with different things. The article was about the COVID, but taking one of the cases here, some of the children have bad tummy aches. Okay, even adults get bad tummy aches. Okay, for a prolonged period of time, and they go from one doctor to another doctor trying to diagnose, take one medicine after another medicine, and although their tummy feels better, by the time they come to me, they are still scared. So they are hyper vigilant to what the body is feeling. Any sort of like tweak or ache, they will start going, oh, is my tummy going to be so bad?
Yeah. It's coming.
Last year, 10 years ago, or not 10 years ago, 2 years ago, I've had this. I did I eat the wrong thing? So they're so particular that it affects their functioning. Some of them cannot go to school. They stay away from school because school, they stress can cause a little bit of kind of like weird tummy sometimes.
Yeah.
So they just don't want to feel that sensation. Yeah, so we need to process with them. They avoid, like I say, they are hyper vigilant. They are avoidant of certain foods, certain places. One of them was like, oh, I vomited the last time I went to this particular restaurant when I ate the fried rice, so don't want to go there anymore. So the avoidance is there. Yeah, and the anxiety, so they are so worried and so tense.
So Jerry, if that's the case, then this current pandemic we're going through could be a trigger for many people to end up suffering with PTSD.
Absolutely.
Yes, they can, and different parts of it, right? There could be some that have been scolded very badly for not putting on their mask, like shouted at and everything, and for someone that is a little bit more like I'm minding my own business and suddenly you shout at me, that can cause an imbalance in the whole system. Is like, oh, it intruded my safe wall, that whole concept of that. And then they start to look out for people that shout at them, perhaps. So that's on a very small scale.
How do you treat someone who has PTSD who is abusing somebody else because of that? You know what I mean? Like one of the articles that you sent us about the mother who was injecting her son with insulin. So she's suffering from PTSD and the abuse is going on to the next generation. How do you deal with something like that?
Yeah, so sometimes that happens when they are hurt themselves and they don't know how to self-soothe, and they have to hurt someone else because they need to try and make sense of what is going on, or to continue the unsafe environment so that they think that they can manage the environment. So the what we can do is to deal with the perpetrator. So in this case, to deal with the mother.
Yeah, I call this situation PTSD CTP.
Well, CTP?
Call the police.
Go to the police.
You got like you nonsense.
Wouldn't you?
How,
Yeah, you would.
You have to call the police.
Dr. Jerry, how do you deal
Oh,
with
dear.
someone you know who has PTSD then? If
How-
you
how
have
do I what? Sorry?
How would one deal with someone that has PTSD? A friend, a family, you know, how do you handle them? What do you do?
Gentle hands, very gentle hands.
With loads of empathy.
Yeah. So you need to be empathetic. You need to really just wear
Compassionate,
kids' gloves and just deal with them because they can be so wound up. They don't want you to touch or they explode on you. So you need to be very gentle with them and to support them and keep nagging, keep nudging them, keep showing that this current world, this world that they are looking at is actually safe. And it's no longer the old world that they have been living in.
But how do you make promises like that? You know, I mean, with people that have gone through so much abuse and all that, how do you guarantee that the world is safe? Because, I mean, frankly, it's full of awful people at the same time, isn't it?
True. So that what caused PTSD, one of the things is that it is out of their control. So COVID is out of our control. You know, a rape victim, you know, the situation is out of their control. They feel that they have no control. So they learn how to take back control. So one of the not funny things, but one of the experiences that I had was my little boy when he was really, really little. We sent him for swim classes, you know, and you know, the swim coach was really, really bad. He just left that little. So he was, I think, maybe about 3, you know, or 4, and he just left the baby in the pool, and he was a distance away, so the baby is clearly panicking, right? And I was like, so as a new mom, I'm going like, you know, what is going on? And so I gesticulated because if I go, I would scream. Sometimes Jerry turns into a monster, okay? So especially when it comes to you know
children,
my children and my staff or whatever it is, I turn into a monster. So I told the daddy to go deal with him. So you know, true enough, the little boy wasn't going to swim anymore, and it took him many years after. You know, and he always remembered that I was left alone.
Even though he was only 3 or 4.
Yeah.
Yes, and he refused to go to the deep pool. It took a very, you know, kind coach whom we told and let the coach know the situation.
Right.
That, you know, okay, you know, do what you can. Let's play with water first, and that kind of helped him along.
Which village was this coach from?
I hope he's not still
No,
teaching.
It's like, you know, old school. Yeah,
Very
they
old
throw the
school,
kids in the water.
In the deep
Okay,
end,
you know.
Oh,
But-
dear.
Go
They'll
paddle.
float, right?
But
Yeah,
we
go
had-
thread water.
We had the same problems with our girls when they were learning to swim.
Yeah.
There are a lot of coaches out there. Who
Tough love.
Tough love, yeah. It's
Yeah.
tough love.
Okay, we
you
talk about tough
cannot
love
do
on
that.
air.
No, you
Come
can't,
by.
Hold
Traffic.
on. Good morning. We are with Dr. Geraldine Tan from the therapy room, and we are discussing PTSD this morning.
You know, Jerry, earlier I asked about levels of PTSD, and one of our listeners has said, last year I got into an accident on my motorcycle because of another driver. Until today, I have this fear when I prepare to turn right, not when I prepare to turn left. Is that PTSD or is that an irrational fear?
Well, it is him being very alert, you know, because when something happens, your brain learns and it starts to prepare you that there is a possibility that something might happen. Yeah, so you're a little bit more vigilant, you're a little bit more alert. it's not PTSD, it's not permeated like all the different facets of your driving. You can't drive, you're afraid to do anything on the roads itself. You're irritable when someone is beside you in the car. No, so yeah, it needs more than that.
Okay. Good.
Somebody messaged in on our WhatsApp. I think his name is Azman. He said, as a hypnotherapist, I've come across some similar cases of obsessive perfectionist behavior, which often stems from a child seeking affirmation from adults, which is probably what you were talking about with your 50-year-old patient. That was the only way he could seek attention from his father was to go back and get beaten up more. Is that what it's called? Obsessive perfectionist behavior? No.
See, that's why that guy's a hypnotherapist and she's a psychologist.
psychologist.
I mean, he probably has seen different things, but not particularly for this case. So for this particular case, it's clearly complex trauma that has stemmed from a very young age.
Can you hypnotize people as well, Jerry?
Yes, I can.
Okay. So because I realize more and more people are getting certified for hypnotherapy.
Hypnotherapy.
Yeah. Can they hypnotize themselves? Can you hypnotize yourself?
Self-hypnosis, yes, you can.
Oh, wow. How do you come out of it?
Yeah, I was
though?
about to say, if you're hypnotized, how do you get out of the thing then?
You can put a timestamp on it. You can put a cue word on it. You can do different things.
But who says the cue word? Yourself or somebody else?
It can be a cue sound. You can
like
set
an alarm
your
or something,
phone.
right?
Yeah.
Okay.
Yeah.
Wow.
That must be crazy. Can you imagine if you forget to set that alarm?
Gone.
But it's so interesting though, because if you're able to hypnotize yourself, then you can get yourself out of certain. Sometimes we have these thoughts and we want to get the thought out of our minds, or we want to strengthen our minds a little bit. Can hypnotherapy do things like that?
Yeah, like wouldn't you become the most perfect version of yourself if
Exactly.
you can hypnotize yourself?
You can enhance, but there's no 100% for anything.
Wow.
Yeah.
But any form of enhancement is good, man.
Right?
Yeah.
I would think, yeah.
But Jerry, you guys as psychologists, do you use hypnotherapy when someone needs to go to a certain spot in time but can't get there? Is that when you use hypnotherapy?
We can use that, so we can go do a little bit of that regression work. Yeah. I prefer not to until absolutely necessary.
Yeah.
Would you use that for patients with PTSD?
I would
Hypnotherapy?
do other things first.
Okay.
So
Because they're already so vulnerable,
Yeah.
Yeah.
hypnotherapy is the last resort.
Resort.
You don't use it.
For me. I know
for
other
you.
people,
Yeah.
yeah.
Wow.
Yeah.
But it's not harmful though, right?
You would be so I have to access your subconscious, right? So you'll be more susceptible to whoever that is going to access your subconscious.
Yeah, you're vulnerable, right?
And you obviously have to trust that person a lot, because that person's going to know things that nobody else knows.
Well, that's the same with
Doctors.
doctors,
Yeah.
psychologists also.
Yeah.
So,
Gynecologists.
Yeah.
They go where no one else has gone.
Let me just say that I trust you, Jerry. Can you hypnotize me?
There we go.
Yeah,
I knew
see?
that was coming.
It was going to happen, Jerry.
Still
you're
cannot.
invited to the center, but
Oh.
to sit on the couch. But I will not be your therapist. Thank you very much.
Okay.
He keeps trying,
Up
I
next.
know.
Consistency is key.
Yeah. One day she will say yes. One day. All right. Here's the Lighthouse family with High on the Big Show. 1FM.
Jerry, I want to ask the hard question. I hate putting you on the spot.
Ask it.
But I've got this question and I want to ask it. And I think it needs to be asked because people need to understand.
Okay.
You have a patient. You know that patient is a danger to themselves or to their family. Do you keep that knowledge to yourself, or is it, or do you put the safety of the family into consideration and, I don't know, notify the police, notify what, I don't know.
So all the clients are told, and now I say it on air. So everything is private and confidential, except when we tell them they're gonna hurt themselves, hurt other people, kill themselves, or kill other people. So if we are in the know in the session, then we will have to act on it. So there are times when, the client says that they are feeling very bad and they want to hurt themselves. So then we will say, okay, you know what the procedure is. Now I have to tell your next of kin. I have to tell somebody. Yeah.
Is hurting themselves more of a common thing that you see than hurting others?
So they would go for the self first, before, they
Others.
don't explode so much.
It's more implosion.
Yeah, more
Okay.
implosion. So even for PTSD, a lot of self-harm and suicidal sort of ideation and behaviors occur.
That's a great segue into our next topic for about
Saman aunties.
Saman auntie.
Yes. But that one is quite fun. That's you're eating and then suddenly go, hey, who parked the car?
license plate.
喂，来料了，来料。
Hey, Jerry, before you leave us, and I love the words you always have at the end, do you have something to say to people who are suffering from PTSD or families who have someone suffering from PTSD?
Yes, I do.
Or people who think they are suffering from
Yeah.
PTSD.
Yeah.
Always the
think
cynic,
you are?
right? Always the cynic.
Yes. Sometimes you fall apart, it would feel like the end, but really it is the start of something beautiful. So this, I give to the people who are suffering, who feel really, really bad, and reach your hand out to a family, a friend, a therapist, and they can help with that start of something beautiful.
Oh,
Nice.
Nicely said.
thank you so much, Jerry.
No worries. Hi, Julian.
Hi, Jerry. Morning.
I almost forgot my interns. Now that I say so, I've interned Rachel today, who is celebrating her birthday. But they always remind me that whenever Julian comes, I must say my little quote or anything and end.
So it's Rachel's birthday today, is it?
Yes, it's Rachel's
Happy birthday,
Happy
Rachel!
birthday, Rachel!
Happy birthday.
Have a good one.
Thank you. Okay, I'm gonna leave all of you. See you next
All
week.
right, Jerry, have a
Bye,
nice
Jerry.
day ahead. See you next
Bye.
week.
Have a good week.
Bye.
Bye bye.